You're now live.
Right, good afternoon everybody. Welcome to the BCP Council Health and Wellbeing Board for the 6th of October. First off, I will just ask our Democratic Services Officer Louise to go through the housekeeping notice.
Thank you, Chair. Please note that this meeting is being recorded by the Council for live broadcast and will be published on the Council website for a minimum of 6 months. The meeting may also be recorded or streamed for live or subsequent broadcast by members of the public. For those in the room, please note that if the fire alarm sounds, please exit the building by way of the nearest available signed fire exit route and make your way to the assembly point in the gardens opposite, in the War Memorial, by the War Memorial in the gardens opposite the front of this building. Finally, please ensure background noise is kept to a minimum and mobile phones and other devices are switched off or turned to silent for the duration of the meeting. For those in the room, this includes turning off microphones and turning down the volume on your laptops completely. Thank you.
Right, thanks for that. I'll now move on to the agenda items for this meeting. So firstly, apologies.
We've received apologies from Aidan Dunn, Kathy Hadley, Dawn Dawson and David Freeman. And Patricia Miller, sorry.
And Patricia Miller, yeah. And substitute members.
And substituting, we've got Rachel Gravett substituting for Kathy Hadley, Ellie Lynn Pop substituting for Dawn Dawson, and Pam O'Shea substituting for David Freeman, and they're joining us online today.
Okay. I was looking around the room. I thought most of us know most people, but we've got a few people online. In a minute, I will go round and I think just do some very quick introductions. Just as you'd have noted that we've had apologies from Patricia Miller, who's our vice chair, as she's now left her role at the Integrated Care Board, Dorset ICB. So yeah, it's a bit of a loss actually, because it was really useful to always have her in the room and involved in the discussions that we were having. I know sometimes she'd had to send substitutes, but as a result of that, we will be looking for a new vice chair for the Health and Wellbeing Board, but I think we'll schedule that for the next meeting that we've got. So we'll make sure that's in our sort of forward plan for the next meeting. Okay. Right, we'll just go around the room quickly for introductions, because I know we've got a few different faces online today, just so that people know who everybody is. So just very briefly, I'll start with yourself, Richard.
Hello, I'm Sir Richard Burton. I'm the Cabinet with the Children's Portfolio, Children, Young People, Education and Skills.
Could you do the microphone? Do you want to do Richard again?
Do you want to do self?
Those online.
Yeah, okay, this is I'll practice one so I get it right this time. So I'm Councillor Richard Burton, Cabinet Member for Children, Young People, Education and Skills.
Right, Councillor Sandra Moore and a Cabinet Member for Communities and Partnerships.
Hi everyone, I'm Rob Carroll, Director of Public Health and Communities.
Hi everyone, I'm Betty Belton, Director of Adult Social Care.
Hi everyone, I'm Rachel Gravett, Director for Children's Services, Commissioning Resources and Quality, here for Kathy Hadley today.
Hi everyone, Scott Sappin, Better Care Fund Manager, BCP Council.
Good afternoon, Mark Harris, NHS Dorset, Deputy Director of Place for the BCP Place.
Hello everyone, Karen Loftus, Chief Executive of Community Action Network.
Afternoon, Siobhan Harrington, Chief Executive at University Hospitals Dorset. And maybe Chair, just to mention, Jonathan Hickman is now the Chief Executive of Dorset, BSW and Somerset ICB cluster.
Yeah, and I'm not sure what that means for health and wellbeing boards and representations on our, otherwise he'll spend his entire existence going to health and wellbeing boards right across the southwest probably, but yeah, I think that's to be cleared up, so thank you.
Good afternoon, Area Manager Mark House, Dorset and Wiltshire Fire and Rescue Service, Head of Prevention and Protection.
And we'll just go online. Kat, if you could just introduce yourself first.
Good afternoon, I'm Kat McMillan, Head of Communities, Partnerships and Community Safety at BCP Council.
Thank you. And Pam?
Afternoon, I'm Pam O'Shea, I'm the Interim Chief Nurse and I'm here for David Freeman for NHS Dorset.
Thank you. Louise?
Thanks, Chair. Hi, I'm Louise Bate. I'm the manager at Healthwatch Dorset.
Thank you. I've got Kieran, if you want to.
Thanks. Councillor Kieran Wilson, portfolio holder for Housing and Regulatory Services.
We've got Francesca.
Hi, I'm Fran Needham. I'm the Dorset and BCP Safeguarding Adults Board Business Manager.
Thank you. And Sian?
Good afternoon, everyone. Sian Walker-McAllister. I'm the independent chair of the BCP and Dorset Safeguarding Adults Boards.
Thank you. And we have Sharon as well. Is that Sharon Carr-Brown?
Hi. Sorry, I wasn't expecting to introduce myself. I'm observing. I'm Sharon Carr-Brown. I'm a councillor and I chair the Children's Overview and Scrutiny Committee. And I've always been interested in the work of the Health and Wellbeing Board as well.
Thanks for that, Sharon. It's just so that everybody in the room knows who's here. I think it's always useful to do that, particularly on this committee, I find, because we have so many different partnership bodies that usually at council committee meetings, everybody knows everybody. But when we've got so many partners and substitutes and people changing, I find it useful for myself anyway. Right, agenda item 3, the minutes of the last meeting on the 9th of June, which have been circulated. Are members okay that those are accurate? Rob,
just to an amendment that I was also present at the meeting.
You were indeed. Yeah, that's right. Yeah. Right. If there's no other amendments, are members happy to approve those as an accurate record of that last meeting? Yep, getting nods. Good. Okay. Declarations of interest. So just if any committee members have any declarations of interest, if you could just indicate those. No, if anything comes up during the meeting that you realise you have an interest to declare, then please let us know at that time. Okay. And I would just say, actually, we did check, we are quorate today. We've got representatives from the various bodies that we need to make sure we're quorate. But obviously, if there are for votes on particular recommendations, obviously those online won't be able to take part in the vote. Just those in the room can vote. Okay. Right. Public issues. So did we have any public statements or questions?
There are no public issues, Chair.
No. Okay. Great. We can go straight on to agenda item 6, which is which hopefully long-term members will be familiar with. It's the Bournemouth, Christchurch and Poole BCP Safeguarding Adults Board Annual Report for 2024-25, and I'm very pleased to invite Sian as the independent chair of the Safeguarding Adults Board to present the report. So over to you, Sian.
Thank you very much. Fran, if you could put it on from slideshow, that would be helpful, so we've got the whole picture. Thank you for inviting me. It's a statutory responsibility to present our annual report, which is for last year up till the 31st of March to Health and Wellbeing Board every year. And I make no apology that it comes in September because we actually make sure that this annual report is formed by all our partnership members. We have a very active partnership both with our statutory members in the NHS and with the police, and with many other members working in the public and voluntary and community sectors across Dorset and across BCP. The boards work together as one board, but they are separate as one in one meeting, I should say, but they are separately constituted. So that's why we hold a separate annual report for each board as we're required to do so. If we could go to the next slide, please. Sorry, next slide.
Sorry, trying. Sorry.
Okay.
Hang on a minute.
I'll start talking to it. The role of the Safeguarding Adults Board is a statutory responsibility as defined within the Care Act. Members will have received this annual report from me before, so we'll understand our statutory responsibilities. So I don't intend to go through the detail as we've defined on the slide, other than to say that we are required to publish a strategic plan, and we have a 3-year strategic plan. We're required to produce an annual report outlining what we've achieved in our strategic plan. We're also required to commission safeguarding adult reviews where an adult with care and support needs has died, or where there are other significant circumstances that we need to commission a review to understand why agencies, plural, didn't work together better to understand and to ensure that that adult could have been protected better. I'm only publishing one safeguarding adult report for BCP SAB this year, and that's been outlined in the annual report, which you've all received, and I'll go into that in a little bit more detail. If we can go to the next slide, please. So the next slide just sets out our safeguarding activity during the year. When one compares this data to the data last year, it varies by about 1 or 2% compared to last year. It's not showing me anything significant, and I see annual reports nationally from other safeguarding adult boards as well. There's nothing that gives me cause for concern. There are fluctuations during the year, and those fluctuations are reported via our quality assurance subgroup, and deep dives are undertaken where that's necessary in terms of if there is a concern, there'll be a deep dive or an audit into a particular area of practice. Members will be aware that in safeguarding adults, there is a lead statutory partner, and that's adult social care. So all the data that we get is data that goes in through adult social care. And two particular sections of the Act, 42.1 for safeguarding concerns and 42.2 of the Act, where those concerns are converted to inquiries. And we break down the data so that we can have a better understanding of that. In BCP Council area, there's a 21% conversion rate. That's pretty standard. It can vary between 20 and 35%. The data that we provide annually to the Department of Health and Social Care, and I say the royal we there, that Adult Social Care provides to the Department of Health and Social Care every year on safeguarding adults, and every Adult Social Care department across the country presents, will vary because there are different interpretations of the requirements, and the regulations aren't as clearly refined in terms of what they stipulate we should present. But the numbers of concerns that come in are relatively high. That's a good thing. That's showing, not high compared to others, but that's showing us that people understand the nature of the Act and the requirement to report concerns. And we expect that those numbers to be whittled down considerably, as some concerns will be where this is the first contact with adult social care for maybe a family concerned about an older relative. And the response might be to undertake a Care Act assessment to see whether there are any needs to be met by commissioning adult social care services for that individual. It may be that referrals are made to the voluntary and community sector. And what we've realised this year is, in terms of the concerns received, they're down 3%, and that's because work started during this year to enable our partner agencies to better understand concerns and not to refer concerns where really the referral was about wanting an adult social care response only. So we're getting better as a community of partnerships in referring adult social care concerns. Go on to the next slide, please. This is our strategic plan. You will have seen this last year, those members who were here last year, and it's in the full report that you've all received. It's a 3-year strategic plan, which we'll be refreshing at the end of this year. And there are no surprises there. Our primary aim is around prevention through effective partnership working. Accountability is important, and seeking assurance is important. So the role of the board, which is not an operational service, is to bring partners together to prevent, to seek assurance, and to promote accountability across all sectors with partners working together. Move to the next slide, please. So our key achievements in this year, these have been set out within the main report itself. But we've done a lot of work on prevention, and we outline there the work that's been undertaken, working with the coroner, working with public health, working with prisons and probation services, which is important because adult social care has a statutory duty for the care of those prisoners who need services as defined by the Care Act. But also it's an issue of community safety, and we want to work in partnership with the other statutory boards across the council, the Community Safety Partnership, the Children's Partnership as well, to ensure that we're working together and that our work isn't repetitive or that we're working inefficiently. And we continue to seek assurance from partners across the system. When we undertake a safeguarding adult review, we publish when we've agreed to publish. We publish the whole review on our website, and we also publish a 7-minute learning because we're realistic in understanding that not all partners are going to have the opportunity as teams to address maybe a 28-page or 40-page report. So the 7-minute learning really pulls out the key points of learning, and those are the areas that we continue to seek assurance about through discussing with our partners. And one of the things we do annually is have an annual event on safeguarding adult reviews, where we look back through not just the current year, but the previous year's safeguarding adult reviews and some safeguarding adult reviews of national significance, and we share learning, and that's good for continuing professional development of our staff. We generally have an attendance of about 300 to 400 staff across our partners for that event, but it also provides an opportunity for assurance on learning. And the final bit there is around making safeguarding personal, which is the underlying ethos of the Care Act in terms of working together with people and enabling them to determine for themselves where that's possible. Or at least for us to work knowing what they would have determined for themselves if they don't have capacity to do so in any intervention that takes place around safeguarding. So all this detail is in the detail of the report which you've already received. May I go to the next slide, please? So this is the one safeguarding adult review published in the year, and we're required by statute to present a précis of the work that we've done on commissioned reviews. There are more in the pipeline this year, but they're not yet. Some have been published already, and but they won't come into this annual report, so you hear about them from me next year. So Edward was a younger adult of working age, 35 years old, who lived alone, and where he was being cuckooed by some young adults and young people. And when he was eventually murdered by 2 young people who are now in custody, we work closely with the Children's Safeguarding Partnership to ensure that they were able to deliver all their work that was necessary in reviewing and understanding why two 16-year-olds had committed such a crime. But then we've also been working with all our partners to have an understanding of what went wrong, why there wasn't so much a team around the person. And one of the things that really came out with this safeguarding adult review was in respect of cuckooing, where many people have believed it's a crime, and it's not a crime, but it is being considered within the new police and crime legislation that's being brought before Parliament in the ensuing year. So we know that there'll be lots of learning from safeguarding adult reviews where cuckooing has been a significant factor, where people will use somebody's house for drug dealing, drug taking, or for accommodation, and are often coercively controlling the individual. One of the issues with Edward was that he was intelligent, he'd gone to university, he owned his own house, and there were lots of assumptions made around how he could manage and he could cope. And he would go for assessments and then decide to opt out of receiving a service, and there was a lack of follow through. So a lot of learning across the partnership in relation to Edward, and indeed we've escalated some of the issues nationally as well to be brought together to the Department of Health and Social Care with other SARs that have contained references to cuckooing. So next slide, please. So just finally, some key messages for members of the Health and Wellbeing Board, not committee, I apologise for that. So we have agreed protocols for closer working with Her Majesty's Coroner for Dorset, and that's been really important. And I always talk about working efficiently, and sometimes coroners will be already starting to investigate a death and may decide that they need to put that on hold pending a safeguarding adult review, or may decide that it needs to conclude before we conduct a safeguarding adult review, or that we may not need to do so. And in fact, there was one coroner's report in respect of a death of an individual where we felt there was a regulation 28 issued to a local healthcare provider, and where we felt there was no further learning that could be really achieved through commissioning a safeguarding adult review. So we recommended by the coroner in that regard. We've strengthened our relationships absolutely with focusing safeguarding prison and probation, and we do a lot of work with our housing colleagues. We don't have a housing subgroup, but we have a housing and safeguarding engagement group, which meets separately outside of the board, and which we support and provide information for, and hold an annual event with to discuss issues of key importance. And in this year, last January, we held an event around release of prisoners and discharge into communities and housing, and how if we can get those pathways right, we can not only do our bit to be promoting better community safety, but we're doing our bit to promote safeguarding for some incredibly vulnerable people who, although they will have committed a crime, may still be incredibly vulnerable in their own right, and we have a duty to support them. We do lots of audit where we feel that we need to sort of dig down and get a sense of how things are being delivered, and that's being overseen by the Quality Assurance Subgroup. And we remain committed to ensuring that people's voices and their lived experience is reflected in all our learning. We have a community engagement subgroup, and we will probably be reviewing how we deliver that through perhaps a community of practice, through a different approach, because we want to engage more than just have a subcommittee of the board, but we want to engage with people with lived experience better, although there are people with lived experience actually sitting on that current engagement subgroup. And we'll be refreshing our strategic plan at the end of this year, and that will be reflected in next year's report. Next slide, please. And questions, that's me. Thank you.
Thanks for that run through, Sian. I know there's an awful lot of work goes on within the Safeguarding Adults Board, both at the meetings and outside of the meetings, certainly. Any questions or points that any board members want to raise? Siobhan.
Siobhan Harrington from University Hospitals Dorset. I did enjoy reading the report. I always find when you have a case study within them, it's very impactful. And that story of Edward, I didn't know much about cuckooing, and actually it's really just sort of struck me. So I think that is incredibly grounding and powerful for us to read. I suppose that just in terms of reassurance to the board, I think the working relationships between our colleagues working in safeguarding and health and across the system is actually really strong.
Yes.
And we've obviously got things we can always do better, but actually I just really wanted to say I welcome the report and thank you.
Thank you very much. And the relationships are really strong, and we have excellent attendance from both our colleagues in NHS Dorset. Pamela O'Shea is here today, and she attends our board, but also all the providers, which is really, really important. So, and the whole issue around personal safeguarding stories is an issue dear to my heart, and it's something I actually learnt from when I was a non-exec director on an NHS board with patient stories that used to come to board meetings. That it really brings you back down to earth at the start of a meeting when you hear the story of somebody. And I deliberately call it a story rather than a case study, because I think story is much more impactful. You hear about the issues, and it reminds us all while we're sitting around a table, and sets a tone for meetings and for what we do. So, and we had a brilliant one in this year, where we had somebody who was living on the streets in Bournemouth, who is now in settled accommodation and was supported through the social workers provided by BCP Adult Social Care into the homelessness team to actually become settled. And it was I won't say heartbreaking because he was happy, but heart-rendering in terms of his story and what we learned. So and lots of stories like that coming all the time. They're not always good ones, but we learn from them as well, but that one particularly was.
Betty first then. Betty, yeah.
Yeah, thank you, Chair. I just wanted to pick up just further to what Siobhan has just commented on. It's more an observation. I think two really key areas of work that have really provided beneficial across all partners and across the system that the board have been involved in have been the memorandum of understanding that all partners came together and were able to produce, and that was very much centred around us having experienced, particularly in UHD hospitals, but not unique to that. It was happening in our other sites as well, where we had tensions between mental capacity and mental health legislation. And our lead, you know, I'm looking on screen and I can see Suzanne worked really closely with Siobhan's lead for safeguarding PIPA and our colleagues in PAM's areas across the ICB. And we were able to come together and sign off at the last board that actual agreement, which will really help those individuals that are in our hospitals where there is that real tension, and it's not easy, the tension between legislation, not between partners wishing to kind of, you know, work their way through that for the best interest of the individual. That is a really, really good piece of work, and I'm already being told that others outside of our geographical area are asking if we will share that. So that's really, really promising. And then just picking up again on Siobhan's point around cuckooing and, you know, what happened with Edward. And we recently launched the training event around Edward, and it was really, really heartfelt to see so many staff. I mean, as Sian said, hundreds and hundreds of staff, not tens or 20s of all of our staff as a system. And it is really, really helpful. We do the SAR learning and feedback incredibly well within our system, and it is really important to acknowledge that and the brilliant work that goes on within the board. Thank you, Chair.
Add Rob next.
Yeah, thanks, Sean. I just wanted to really congratulate the partnership on producing the report. I really enjoyed reading the report and thought it was really comprehensive in summing up all the work that is taking place. Particularly enjoyed reading the partner assurance section and reading about how our partners are also looking at their achievements, but the challenges also that they experience in relation to effective safeguarding of adults. And really great to see that section on the learning from SARS and how they're being taken into account within each organisation as well. And personally, I enjoyed seeing those references to the work we're doing around suicide together, and also the work that our colleagues in the Fire and Rescue Service are doing with Prama Life around hoarding, and the work around violence against women and girls as well. And I just had one comment really. I mean, my first comment was in relation to trend data and whether we were seeing referrals increasing or decreasing, but you've actually answered that within the presentation. The other comment that I had was thinking about the 10-year plan, and as we move to more digitally based approaches to accessing health and care, whether that potentially increases any risk around safeguarding. And I think I read in the report there was an issue around coercive control and partners potentially being able to access their partners' health records through the NHS app. And I'm just wondering whether that is something as a partnership we need to be mindful of in the future, and making sure we've got safeguards in place as we move from that analog to digital approach as signalled within the plan. It potentially increases some risks, doesn't it, as we move to a more digitally based model. Thanks.
Yep, Sean, did you want to?
Yes, please. So it's great that you raised that, because I think it's something that we want to discuss with our colleagues across the partnership, around how it's even more important that we are aware of the risks to not being able to observe independently how safe people are, and how they are managing the risks that they are exposed to when people digitally access. But you know, we've been in our digital world for a long time now, haven't we? And certainly enhanced considerably since we had COVID and lockdown, and we've been working more often kind of online. I think it's something that we would like to address, and we're considering how we look at specific topics for our annual development day next year, and that might be something that we would focus on. I thank you for raising it.
Thanks for that, Sean. Karen, did you want to come in?
Thank you. I really enjoyed reading the report as well, and it struck me when I read safeguarding is everybody's business, because it is, and looking at some of the statistics, because I do enjoy a statistic, but also that a lot of abuse is actually carried out by someone that you know and in your own home. And that is why I think it's, and I would be remiss not to say this from the voluntary sector, would I not, that how important it is that we have community around people, and that especially around cuckooing, that we have neighbours, that we have community centres, that we have good people that go, I'm not, something's going on here, I'm not happy about this. And, you know, obviously I've worked in children's services, I've worked for the NHS, and I'm not, but it's so important that the voluntary and community sector and neighbours and neighbourhoods are very much part of the solution, of the helping to solve this. So I just think we just need to, as a board, really keep that in mind. It's so important.
That's a good point. Sean, did you want to come back?
Yeah, if I may just come back. So when I was offered this position some 4.5 years ago now, my commitment was to engage, make sure we engage really well with the community and the voluntary and community sector, because and the everybody's business bit is really important there, because my mission in life is to make sure that everyone knows if something don't feel right, that we need to do something about it, and that we talk in language that people understand, and that we don't over complicate issues, and that hence the 7-minute learning, so that people across all sectors can use with their staff teams to enable better understanding. So I want us, and we continue, our strategy is around communication, and engagement, and ensuring that people do understand that even if they're just concerned, it might not meet the criteria, which are quite complex around adult safeguarding and very different to children's safeguarding, but that we can signpost them in the right direction. And that's why it's important that we don't think, oh, there's a problem if the 6,000 few hundred odd kind of increases to 7,000 odd in the next year. What that means is that more people understand about safeguarding and have a query and have a question, and they can be responded to quickly, particularly through the work that Adult Social Care has done in BCP under Betty's leadership around refining the front door, and how people can pass that information on, and how that can be triaged in the right way, so they get to see the right person at the right time. Might not necessarily be safeguarding, but it might be, and it ensures that people don't fall through gaps.
Thanks for that. Richard, did you want to?
Yeah, I mean, following on from exactly that point, because it's quite interesting looking at, you know, cuckooing isn't illegal at the moment, although there's an act coming in, just having a quick look at that. You know, where is the line? Is how coercive does a relationship have to be for it to come cuckooing, and when is it not? Because you know, quite right, is that most people are most at risk from people that they know, don't they? And in our mind, we all think cuckooing is somebody that's not known coming in and taking over a house, but it could be the unknown, or there could be a relative, or so just thinking, and it's not really a question, but in my mind, some work has to be done of knowing where that line is.
And it's about team around. It's about team around the person.
Yeah.
And if people talk to one another and make sure that they mention any concerns, that's when things get picked up, which is really important. Even if it isn't some, you know, breaking the law or something, but somebody can raise a concern and then deal with it.
Great, thank you for all those useful points. Actually, don't think there's any other comments. I'll just add my comment. So yeah, thanks as ever for the report, Sean. Really sort of detailed and comprehensive. And as you know, I try to attend all of your Safeguarding Adult Board meetings, which although they're probably about twice as long as a Health and Wellbeing Board meeting, no criticism of the chair there, but there's so much to cover, isn't there, at Safeguarding Adult Boards meetings? I look at the agenda and there is just so much on there, and I know we crack through it in the meetings, but they still seem to, they go on for hours because there's just so many different partners there, and it's so important to make the most of those meetings and the time together. And the networking time and the discussions time is, for me, really important as well. I've sat next to colleagues from UHD at the meetings as well, and had good conversations about safeguarding in our hospitals and stuff. So yeah, they're the meetings are really useful. But and I do like the learning we have from the Safeguarding Adult reviews, particularly like the 7-minute learning, because I think that's really important to make sure that the learning can be distilled and propagated amongst as many professionals as possible that are working with the people and need to know those nuggets of information and actually keep that in their mind. So yeah, thank you for everything you do, the Safeguarding Adult Board. The recommendation we got is just that members note the report, which informs how the Safeguarding Adult Board has carried out its responsibilities to prevent abuse, harm and neglect of adults with care and support needs during 2024-25. So our board members happy to note that report. So yeah, nods all round. Okay, great.
Thank you.
Thank you very much. I'll see you at the next meeting. We'll see you next year at the next Health and Wellbeing Board next year. So, thank you. Right. Okay. Agenda item 7 now, the BCP Safeguarding Children Partnership Annual Report. We've got online, I think, is Anita McGrath.
Afternoon.
Hi there.
Hi.
Yeah, if you'd like to share your presentation. And
I will do, thank you. Thanks for the invite this afternoon. 2 seconds whilst I just find my screen. Okay, hopefully you can all see the slides there.
Yeah, that's great, thanks.
Yeah, that's great, thank you. So, excuse me. Just to run through some summary points of our yearly report on the BCP Safeguarding Children Partnership, and really just a recap as well in terms of what's been happening in the past year. So the Safeguarding Children Partnership, following the disaggregation of what was the Pan Dorset Safeguarding Children Partnership, we were established in July 2024 with the formal arrangements being agreed in December of 2024 and then published. There are 3 statutory partners to a Safeguarding Children Partnership, and they are BCP Council, Dorset Police and Dorset ICB. But we also include our education sector as an equal partner. And they're important because obviously, you know, they see so many children, ideally on a day-to-day basis, but certainly very frequently. And in terms of the role of the Safeguarding Children Partnership, we're here to provide that leadership to our multi-agency working arrangements, making sure that all different sectors and agencies are clear about what safeguarding children means and how we're effective in that. We do undertake reviews of serious incidents. There's criteria to be met around that. So there'll be certain situations where death or significant harm has occurred. And we also look to test the effectiveness of our multi-agency working, and that's also done through audits or thematic inquiries and such like. We've a role to play in ensuring there's multi-agency learning and that there's good implementation of that learning, so that holy grail often of that transfer of learning into practice. And we also have a role to play in terms of identifying those system level issues. So in terms of the yearly report, so it's been focusing of what we've done so far. We're required under Working Together 2023, which is our statutory guidance, to publish a yearly report and make it publicly available. And we aim to be transparent in the activity that we've undertaken around that effectiveness. And yeah, it's published on our website, and I can share that link afterwards. So during the past 12 months, the report has focused on how we've gone about establishing and implementing the safeguarding children arrangements locally. And obviously that has taken a lot of focus, but they are the necessary foundations and structures by which we can have that insight to practice and what the impact is for local children and families. And although there's been a lot of activity around those structural arrangements, there is also continued prioritisation by agencies on actual safeguarding practice, and hopefully that is reflected from each partner's assessment for themselves. And we've undertaken work to test that effectiveness, and we've certainly got more work planned. And what we want to ensure that we always have is that we know ourselves well, that we know what's working well and what's enabling that. And we also know what needs to be developed. So in terms of moving forward, we've also set out what we'd like to progress on. And that is looking at both an individual agency perspective, but also then that collective position. Looking at our independent scrutiny activity and how we want to arrange that. One of the differences you may note between the Safeguarding Children Partnership and the Adult Safeguarding Board is that we don't have an independent scrutineer in place. What we will have instead is we will commission external independent scrutiny each year based around a issue or theme. The activity reported on in this report was around child neglect. We are currently arranging for independent scrutiny on extrafamilial harm. So that's how we're planning to do our independent scrutiny. We also look at the activity and the impact of our partnership groups. We've got a number, and we're conscious that some of those memberships call on colleagues who cover Dorset area as well as BCP. So we ensure that we can do effective join up where we can. And again, what our future steps are to really deepen our understanding, to deepen our insights. I think that's where, you know, we want to mature as a partnership going forward. And importantly, we've got a summary of our reviews and the learning from those reviews and what that should shape in terms of our priorities and our training. To highlight also, we've got at the time of writing this report, we just had some summary points which covered the child death overview panel, of which we have got a crossover in some of our work. And just really to update that, if you weren't already aware, that the CDOP arrangements cover BCP, Dorset and Somerset. We have got some updated staffing arrangements whereby NHS Somerset will be providing the administration and coordination. And after this, or for the notes for this meeting, I'll send round the link for the now published 23-24 CDOP report, and where the previous reports are also available. And looking to our year ahead, it's very much about evidencing our impact. You know, we've had the focus on our structures and coming into place. We want to strengthen our identity of what we are about in terms of Safeguarding Children Partnership, what that presence means, how we can grow our engagement with different sectors. We'll also be introducing a quarterly evaluation report so that we can have those moments of reflection of, okay, so what is the so what factor that we can actually report on, and and we want to be as flexible around that. We'll have some fixed areas that we will inquire on, as well as being responsive to what's showing in our emerging data. And we'll use the findings, certainly from our reviews, to shape our next year priorities. So those are the summary points that I wanted to just bring out. So if there's any questions or comments, happy to take those. Thank you.
Thanks very much for that, Anita. Yeah, any questions from any board members? Karen, first.
More of a comment again, really. It was hard reading, some of this. If you're a human being, you know, the death of a child is always an absolute tragedy, isn't it? And I found it tough. I used to work in children's services and I never became acclimatised. I think if you ever do become acclimatised, you need to leave. So it always affected me, it always made me cry, and reading this was quite, you know, it's tough to read, isn't it? And I know we're doing everything we can to protect these children. What I found was quite interesting was 4 of the 5 from the reviews, there was domestic abuse and or sexual violence and exploitation around it. Out of the 5, there was 4 where that was taking place. And I would also say, as somebody that trained as an early years practitioner, that, you know, that is where that community focus comes again around, you know, takes a village and all the rest of it. You know, we need to make sure that our communities are aware of, you know, I remember many years ago, before I was even in early years and did my degree, I reported a neighbour because I thought something is not right here. And I was right. And, you know, she gave me a bright mouthful, but I didn't care because I thought actually what was really most important here was this little child who I could hear screaming, and then all of a sudden it went quiet. And I thought something in my bones said I have to do something, and I did. But so I commend the report, and I think that, you know, a lot of voluntary and charitable organisations are working really well with children and young people, and we're trying to do a lot of that joining up. But I think we could still do better, I think, in terms of how we all join up in terms of safeguarding our children. If I was going back to my teaching days, I would say we could do better on that, all of us. Sorry. You've hit a rich stream of passionate care here.
Thank you. Yeah.
Once an early years practically, it never leaves you.
Thanks for that, Karen. Rob, did you want to?
Yeah, thanks, Anita. Again, really enjoyed seeing the breadth of the report and reading about all the work that is taking place. I just wanted to ask a bit more about the child exploitation risk assessment framework, because in a previous role, I did a lot of work to try to embed SERAF within different NHS organisations particularly. So just wondering how widespread that tool is in the BCP area in terms of its use. Is this something that our NHS partners are routinely using? And are there any, from your perspective, are there any gaps in terms of where that tool could be used that you know, where it isn't currently being used? Thanks.
Thanks, Rob. So that's exactly where we're going to be pointing our independent scrutiny to do an evaluation of the use of that tool across all partners. I think it is fair to say that the use of the tool isn't as embedded as where we need it to be at the moment, and that's why we are looking at undertaking that scrutiny. The format of the scrutiny is actually is going to be a peer review, so that we really can learn and take a viewpoint from that operational perspective, from that frontline impact, and it's also understanding how to best design a tool so that practitioners and professionals in different settings are able to use it and make that assessment and ask those right questions at the right time for the young people that are presenting to them. So I think it's fair to say that it's out there. it is being used, but we definitely can see some opportunities to strengthen that. And that's what we'll be looking at evidencing through our peer review work, which will be taking place towards the end of this year and into early next year.
Thanks for that. Sandra, next.
Yeah, thanks, Chair. Yeah, could I just say that I also thought it was a very good report. Again, it was very readable, although the subject matter can be a bit upsetting. But it was well put together, so that was okay. And I particularly like the case reviews, because I think that they actually bring the report to life. And you can be there in the topic and feel for it. So you know where you're coming from there. So yeah, very good. Thank you.
Thank you.
Betty, next.
Yeah, thank you, Anita. There's just two observations really. One's a bit of a question, but the other's an observation. One of the things that struck me in the report, and just through what the narrative that you've just given is that of knowing yourselves really well. And I think that's really important, isn't it? So that you know what areas you need to do further work in, and what areas that you are doing good work in. And I thought that was really heartening to hear, that that you have the confidence to be able to say that you know yourself as well. So I just wanted to acknowledge that. I think also for me it was just a question, and it may not be one that you can answer right now. Having noted that the establishment of the board, being BCP, Safeguarding Children's Partnership, and the move away from the Pan Dorset one, I think you're just over a year now, and I just wondered, are you beginning to see benefits to that, in the sense of it being a much more localized lens, and I just wondered, it might be useful for us just to hear if you're in a position to, just on that. Thank you.
Thank you. Yeah, I think that's a really important point, and a really kind of central point to where our focus is for the partnership. And what I mean by that is that living within a coastal urban area for children and families has got differences and different challenges to, say, children and families in more rural areas. So if, for example, we look at our work around neglect, we did have a Pan Dorset task and finish group looking at the work for improving our responses to an identification of child neglect. We've taken a decision to move that so that it is BCP area only, precisely because we need to understand what it's like for our local children and families, and also for our practitioners, whether it's in schools, whether it is in our family hubs, how they're responding to that. And similarly, looking at exploitation, we have I don't know if there's any police colleagues on the call at the moment, but our numbers around knife crime, for example, are significant, and we need to be able to understand what the local dynamics are around that, what it means to be at the end of a train line, or sort of destination for county lines and such like. And similarly, in terms of, you'll see in the report our child protection numbers, and so what does that mean in terms of how we're intervening and supporting those families. So I think we're starting to see that, and again, it's something that we can strengthen, and therefore what resources we provide to our multi-agency workforce working in our primary schools or secondary schools and such like. So I think we're starting to see that more, and within this next year our communication will start to reflect more of our BCP needs and identity for our children and families. So we have a new website being developed. We'll update our resources around that, and make sure that our practitioners have got some of the tools that they that they need to support their working together. If that helps at all.
Thanks for that. That's very helpful. Rachel, did you want to?
I just wanted to formally thank Anita because Anita hasn't been with us that long as our safeguarding partnership and partnership manager in children's services, but she joined us at that time of significant change in moving from the Pan Dorset to the BCP board. So, and she's worked extremely hard under some difficult circumstances to be able to get us all moving. Kathy's the chair. Unfortunately, she's on holiday, otherwise she would have been presenting today. But I think a lot of that background work and the quality of this report is down to Anita and her team and how they've progressed this safeguarding partnership since July last year when we became independent. So thank you, Anita.
Thank you.
Thanks for that, Rachel. And if there's no other comments, yeah, I'd like to thank you for a really sort of useful and insightful report. And like a number of colleagues have said, that there's sort of real stories within there are the sort of really sort of make things very sort of clear to sort of why we're here and why we do what we do. So if there's no other sort of comments or questions, then just falls to the board to the recommendation is just that the BCP Health and Wellbeing Board notes the establishment of the new BCP Safeguarding Children Partnership, the multi-agency safeguarding arrangements in place, identification of its effectiveness to date, and the areas to be developed. So if members are happy to note that. Okay. Nods around the room. Yeah, great. Thank you for that. And thank you very much, Anita, for attending and presenting. That was really useful. Thank you.
Thank you.
Great. Rattling through the agenda now. So agenda item 8, one of our regular presenters, Scott, to talk to us about the Better Care Fund and the 25-26 Q1 report. So yeah, if you'd like to present that, you've got present.
Thank you, Chair. Good afternoon, everyone. I'm here to present the Better Care Fund 25-26 Q1 report. I've also got Jenny Crawshaw with me as well from NHS Dorset to help me. So we've brought we're bringing this to the board today to give a glimpse into how the Better Care Fund has been utilised since the plans were approved by the board back in March. So this report provides detail on the expenditure of the schemes from April to June 2025, and we'll also review the progress of the metric targets that were set in those plans as well. The data was collected in partnership with scheme leads, members of the ICB and our wider system partners. As part of the conditions of the Better Care Fund set by central government, this report was submitted to Better Care England on August 15th. A confirmation that both BCP Council and NHS Dorset are adhering to the national conditions of the Better Care Fund makes the first part of the report. And the latest update regarding the Section 75 agreement, which will be ready for the Q2 submission, had to be given as well. Since the start of this reporting period, partners have met regularly to discuss progress in the BCF to ensure that we are following the plan and that they are in line with the objectives of each scheme, while also complying with the funding conditions that were set by central government. And then we'll just touch upon the metrics. So I'll go to the residential admission metric first, and then I'll hand over to Jenny to touch upon the hospital-related metrics. So for residential admissions, we were on track to meet targets. So we set a target for 110 residential admissions in that time, but the actual results for the quarter were 85 new admissions. So with that, some of the things we put into that to try and meet that target was we have an increase in the hours in our Apex Rapid Response Service. That's enabled a greater capacity and responsiveness to support people return home following discharge and allow them to return to independence. And we've also got a greater community reablement pilot that we've just launched recently as part of BCP Council's Fulfilled Life Transformation Programme. So once again, that will enable people to recover at home and get them back to independence. And Jenny, if I go over to you for the hospital metrics, please.
Yeah, thanks, Scott. We're also on target currently to meet our hospitalisation, sorry, I can't speak today, for people over 65. And the way that we're achieving this is a combination of work streams, but most significantly with the Future Care programme and our focus on alternatives to admission. And what we've been doing is increasing our utilisation of same-day emergency care and referring patients directly from ED into those services, and that's maintaining a success rate, which means people are going home from same-day emergency care of 75%, which is really quite high. So rather than people having a long length of stay in ED and then ultimately being admitted, we're actually getting those people home. We're also utilising or referring rather patients out into community services from ED. So we've been strengthening relationships and knowledge of our community services and introduced a pathway where ED can refer patients directly out into those services. In the east of the county, we have a community liaison practitioner who has a good understanding of community, and she's working in the ED department identifying patients who are suitable for alternative treatment and care in the community, and she facilitates those people going home. So with those two parts there, we're actually making quite an impact at the moment, particularly in the east of the county. In addition to that, we're also increasing our referrals through hospital at home services, so whether that's with the acute themselves or out into the community to avoid people having a length of stay in hospital. In terms of discharge delays, again, this is another piece of work that we're doing with Future Care, and the transfer of care hub is a work stream within that. So we have better discharge planning within the acutes. We're rolling that out across the 56 wards at Bournemouth currently, and also in Poole. And it's early discharge planning on the ward, who then also report into the TOC hub to plan those people's discharge and access packages of care. And also we're improving how we track those people on their journey to get out of hospital. So we've got a better system for ensuring that nobody has an extended length of stay unnecessarily, and we're keeping an eye on those people. Thank you.
You also all right to do this slide, Jenny?
Yes, okay, thanks. So within the BCF across the county with both the BCP and DC, we've been having conversations, as Scott alluded to earlier. We've been meeting more regularly as groups, and part of our discussions have been aligning the the Future Care outputs and benefits to Better Care Fund, with an intention of having that joint oversight and ownership of intermediate care services under the umbrella of BCF, and having those clear commissioning intentions to help us sustain our intermediate care services in the future. So that's just a little bit about what each of the work streams are for Future Care, and we'll give you an update in the next report around how we're progressing with our planning for 26-27 and how we're moving towards aligning our future care objectives into the BCF.
Thank you. Let's come back to the expenditure of the Better Care Fund for that quarter. So over April to June, roughly about 24% of the overall Better Care Fund budget was spent, which is about £19.5 million. Within all 55 schemes that are part of the Better Care Fund, expenditure is on track as well. And I just wanted to give some quick examples of those Better Care Fund schemes that we've got in place. We've got the Disabled Facilities Grant that's enabling people to stay independent at home through housing adaptations and able to use the equipment service as well. We've got intermediate care services that provide the best possible care in the community. We have NHS services, so we've got palliative care district nurses that are also providing care in the community. We've got our voluntary partners as well that we help. And there's also support going towards unpaid carers through the BCP carer support as well. And then we just wanted to give an overview of some of the outputs that were delivered through the Better Care Fund in Q1. So I'm not going to go through all of these, but it's just to give an idea. So with the Disabled Facilities Grant, for example, we managed to do 49 new housing adaptations within that time, and also provided about 1,300 people with access within the equipment service as well, while also changing the provider that we had for the equipment service. And we've also had carers activities, so we 16 different ones in that time. So that was cinema screenings, lunches, even things like kayaking and paddle boarding as well, just, you know, mix it up a little bit. And then we had reablement at home services that has helped increase independence, and it's reduced over 150 hours of packages of care through those for the people that accessed it, and allowed 52 people to become fully independent following that reablement service as well. And we also got some feedback from people that have used the services. So first one we've got is somebody who used the Prima Life Focus Walking Group, which is a service that they use after reaching out to urgent community response. So they said they felt 100% better, and that people have taken an interest in them as a person, and as well as understand their caring role a lot better. It's, you know, improved their well-being. And then we have somebody who had a fall at home and reached out to the urgent community response, and that felt reassured when someone checked up on them and gave them advice on how to receive more support, including a weekly phone group, so they weren't feeling as lonely. And then BCP's Lifeline Care Technology as well. We have a daughter who needed some help for her widowed mother. So we had a device installed in the home to give vocal prompts to her to remind her to stay inside, which has helped give that daughter reassurance, and it's helped the mum stay inside and also stay independent. And then from our community equipment service, so it's not just about when we give them the equipment, but also what we do following as well. So this one was after, unfortunately, someone passed away, but the family still wanted to give their thanks to us that we collected the equipment in good time. And it was a big part of their journey, and after losing their mum as well. And then just looking ahead of what we've got next for the Better Care Fund. So I will be back at the next Health and Wellbeing Board in January next year. Currently, there are discussions also taking place with our partners to look into 26, 27. And of course, any updates from that we will share here at the Health and Wellbeing Board. Thank you.
Thanks very much, Scott. That was informative, and I do like the examples that you had in there as well. Yeah, any questions from board members? Betty, did you want to?
Thank you, Chair. I just wanted to acknowledge all of the hard work that goes on into the BCF, the Better Care Fund, you know, across our system. And also that there is, just to acknowledge that there is a vast amount of activity and areas that is covered. I think we have over 50 in total. You've just got a small snapshot of it today, and it's one of those areas that everybody wants a slice of, literally. So it's always very challenging to navigate our way around the money that we have within the BCF that we put into it, into the Better Care Fund. And I also just wanted to cite really that we are expecting some national changes to the BCF. We haven't officially had what might be recommended in if there's going to be any changes made to the Better Care Fund, possibly linking in with health neighbourhoods and aligning more to the 10-year plan. And one of those key areas that I would imagine that will continue to be really strong within that will be intermediate care, but it could be that some of the other areas that are currently funded within it might come up, might be questionable whether or not they are still in it within the future. So I guess why I'm raising that is to put a plug out there for when the consultation comes out, that we need to make sure that we are responding to that consultation. And I know certainly, you know, the Southwest, the regional groups will also pick that up to make sure that that happens. But we are expecting some form of a consultation on the BCF, and it is critical that we're all sided on that and that we're all contributing and do one response, you know, from our system, but also in our own areas as well. Put more weight behind that in the areas that are really key for our population. Thank you, Chair.
Thank you. Siobhan, next.
Yeah, it's really, thank you for the presentation. I thought it was lovely to see the voluntary sector providers within the sort of examples you gave, because actually that is the direction of travel, and we need to be supporting that as a system in Dorset. My question, I suppose, when you look at how it was presented around on track to meet targets, I just think as a health and wellbeing board, ideally, you would have some of the objective data that shows where we are against whatever target. Because as we move forward with the 10-year plan and neighbourhood health, I think it's going to be really important that we've got the data that helps us look at what's working really well and actually what's not, because we're going to have to be quite agile as we go forward. And I just think that bit for me was just a weaker part of the presentation, which I think next time, if you could bring back a bit more of the data, that would be helpful.
Thanks for that, Siobhan. Yeah, Karen, did you want to?
I didn't put Siobhan up to that because I was going to say exactly the same. You know, and we have some fantastic charities and community groups, don't we, in the BCP area? We're really lucky. There's some amazing groups, and I just want to say that the Prama group, the walking group, is completely voluntary run. And I know one of our volunteers that I know, Jeffrey, volunteers on the walking group. And he's an older guy who's there for the older people, you know what I'm saying? You know, and he's amazing, and he's getting just as much out of being a volunteer on that walk, by the way, as some of the people who are getting involved on coming out on that walk. And I'd really like to share, not now, but I really would like, if we can, Chair, distribute. We made a really short film that was shown at the Integrated Care Board about the value of volunteering and how important it is, and we actually got some people to talk about their experience of giving back to their community and how important it is. It's only 3 minutes. Oh, you'll be all pleased to know. But it is so important, and I know my really small team work tirelessly at the hospital with the discharge team, don't they? And I think my latest numbers, I was trying to find them, we're well up to saving the NHS nearly £500,000 on time to get helping people to leave hospital safely and well and not bounce straight back in, because that's not good for anybody, is it? Nobody wants to do that. So yeah, that was my bit. Thank you. Same with the stats as well, right?
Thanks for that, Karen. Any other comments from anybody else online? No, I think you've got away reasonably well with that, Scott. Thanks for the my only comments are that I did find that useful, actually, particularly the slide you had about the examples and the feedback that we'd had from certain people on some of the schemes, because I think Betty's right. It's a big thing. There's about 50 schemes. I think when I came into this role, it's like, oh, there's this Better Care Fund there. It's about 80 million pounds a year. There's 50 schemes that are delivered through it, and you can look through the long, detailed list of everything that's done through that. And actually, if I put it in sort of the context of the council services that we deliver, and actually, if you measure it against the sort of 80 million pounds worth of 50 types of services we deliver across the council, that's a massive part of what's being managed. And I know it's a real partnership between the NHS and the local authorities and the voluntary sector to deliver all of that. But that's a real massive volume of delivery and activity on the ground. And certainly it was useful to see some of the things I'm aware of. I was recently in a future care meeting, and they talked much about same-day emergency care and the improvements that's delivering, the voluntary sector being right there in the hospitals, and the transfer of care hub as well. So it's good to see the sort of some of the initial results coming through from that. And actually, some of the examples you had, Access Wellbeing Pool, I attended week before last, Macmillan Coffee Morning. I thought I'd just drop in. I've had a few invites to go down there, and that was really useful to see the staff there, the voluntary groups that are using the place there, the health workers that are there, and bumped into a couple of our social workers who were there actually using it for doing online meetings and that, and it was really real eye-opener to hear about what they're delivering and how that's sort of developing. As well as the Lifeline technology you talked about, I recently visited them to have a look around their operation because they'd moved bases. And yeah, that's serving hundreds and hundreds of people right across our conurbation every week. So yeah, there's so many people benefiting from all of that work that's going on. It's easy to sort of miss that as that's a council report that went to the Health and Wellbeing Board. But I think we really need to remember there's thousands of people out there benefiting every day from all of those activities. So yeah, thank you for that, and yeah, we'll look forward to seeing you next time. Now, do we have to? I've just lost my place. I think the recommendation, we've got to approve that, haven't we? That retrospectively approved that the Q1 report that's gone off. So is everybody happy that we retrospect? I don't know if we ever have not approved a retrospective report that's gone in, what we would do, but is everybody happy to retrospectively approve the report that was sent back? So great. Thank you very much. Thanks for that, Scott. We'll see you at the next meeting. Thank you. Right. Straight on to agenda item 9, pharmaceutical needs assessment. I know this is an important report that we do have to actually approve, having scrutinised it and asked questions of Rob and his team. But yeah, Rob, are you going to be presenting that yourself?
Shall I do a brief?
Yeah.
Thank you, Chair. Shall I do a brief introduction and then I'll hand you over to colleagues that have done the work, and they'll be able to talk board members through the paper and through the pharmaceutical needs assessment and answer any questions that board members have. So the Health and Wellbeing Board does have a statutory duty to produce a pharmaceutical needs assessment every 3 years, and that is in accordance with legislation and national guidance. And essentially, the pharmaceutical needs assessment, which I'll refer to as P&A for shorthand from now on, is a statement of need for pharmaceutical services in the local area. And the pharmaceutical needs assessment is essentially used by the NHS to aid in consideration of applications from pharmacies wishing to join the local pharmaceutical list. So it's used as a market entry tool and enables the NHS, in this case the Integrated Care Board, to make decisions on whether more pharmacies can enter the market. But the information is also used by ourselves in the local authority, particularly in the commissioning of our own public health services that we have in community pharmacies too. Previous pharmaceutical needs assessment was published as a Pan-Dorset P&A in 2022, and that was updated by a supplementary statement in May 2024. And this P&A that has been developed is a single document, again covering both Dorset and BCP Health and Wellbeing Board areas, and that was agreed during the transition that we would produce a Pan-Dorset document, and it is now due for publication in October. The document's been produced by a steering group led by the Public Health and Communities team at BCP Council and the Public Health and Prevention team at Dorset Council, on behalf of both Health and Wellbeing Boards. And I'd particularly like to thank Health Watch Dorset, who have been active members of the steering group, but who also conducted a public pharmacy survey in September and October last year to gather patient feedback for the local P&A. And the survey collected 907 responses, and the findings have been used to inform the P&A. So what I'd like to do now is hand over to two of our colleagues. We've got Rohan Mongru with us, who is a public health registrar at Dorset Council that has led on this piece of work, and Lee Robertson, who is a senior public health analyst here at BCP Council.
Yeah, thanks, Rob. Thanks everyone. Thanks. Well, it should be the chair and the board, but also Louise for helping us facilitate the admin in getting onto this meeting. So thanks very much. I should acknowledge. So it's a large document. P&A. There's contributions from a range of people. We've already mentioned some. It's good to see Louise today. Two consultants, Jane Horn at DC and Paul Igweden, reviewed it as well, and the directors of public health. So thank you, Rob. In the process of writing it, so I think Rob mentioned that we follow the national guidance. It's a statutory document. It goes through the steering group, and it included a mandatory 60-day consultation, and that was with stakeholders and the public, and feedback from that consultation carefully reviewed, and that made amendments to the original draft. That's collated in Appendix 1, which was kindly put together by Nat Morris and Health Intelligence and Dorset Council. So the P&A provides a snapshot of service provision at the time that the data was taken earlier this year, but it does allow for the provision of supplementary statements to be added, and that can reflect any significant developments during the course of its 3-year lifetime. And I guess speaking to that, we are aware of potential quality issues, potential closures, and we do work with commissioners and of course the ICB. The report does conclude that there were no current or anticipated gaps when we wrote the report, and that's in, of course, DC and BCP, and it does make recommendations in integrated pharmacy into various local care pathways, community pharmacy, mentioned the NHS 10-year plan as an example. And today we are asking the board to note the consultation outcome, and we're looking to approve the P&A for publication. It's due for October of this year. Leaves anything to add?
Yeah, I was just going to briefly touch about the analysis process that we did. So we were systematic and evidence-based. We drew on a wide range of data sources, including the latest census, the Office of National Statistics population estimates. We used local health intelligence and the public engagement survey from Health Watch. And we used all this, and we developed like a tool which allowed us to have all of the mapped locations of the pharmacies and then overlay that with intelligence and some of the data sources that we had. So then we could share the analysis with the steering group and be led by them through the process. Thank you.
Okay, so that's everything. Okay. Any questions from any colleagues, any board members about the pharmaceutical needs assessment? I know we've had it come before the board, but previously when there was adjustments needed during the period of the previous plan, I think when some local pharmacies were changing or closing down and changing locations. But any questions or comments? Now, I understand at the Dorset Health and Wellbeing Board there were a number of questions and comments, but from what I'm led to believe. But I guess for me it's just understanding it. Is there quite a difference between and I know the report notes a bit, doesn't it, about the issues for BCP and for Dorset, the difference between those two areas geographically? I guess for me, is there a lot more sort of focus on access to pharmacies across Dorset because of the more sort of rural nature of some areas of the county? Would that be a fair assumption that actually it's quite a different sort of case within BCP?
So I'll switch that. So, and actually we should, I think, just to take the point that you mentioned first, so this has been presented at the DC Health and Wellbeing Board, and it was just, and Health Watch representative there did give us some helpful comments, good discussion as there has been here today, and it's, we've just given it almost a freshen up to reflect the fact that there's now two departments, and to acknowledge the fact that we're not looking to the future now. This is where we stand, and that will be reflected in the published report. In terms of the analysis model and the analysis that we did in terms of DC versus BCP, and Lee will add some of the detail to this. There was a bit of a difference. There was some comments reflecting the consultation view in DC that affected the rural nature of some of its locations, and how a drive time may not reflect the best representation of all the residents in these areas reaching locations of the pharmacy. So one of the guidelines that we do use on that was a 20-minute drive time, and that was the sole one we've used in this report today, which covers most people, but there are pockets around in rural areas which aren't covered by that, and we tried to duplicate it with a walking time as well, and we've begun some work looking at this and mapping this area and trying to understand that to in more detail, essentially. So, but as we stand at the moment, so the scoping work that we've done on that, going beyond the national guidelines of the 20 minutes drive time, suggests that we were looking at car ownership as one example, transport routes. In terms of car ownership, we were considering that many of the areas in rural areas are considered less deprived on a larger scale and more likely to be the car owners. But obviously, we understand that wouldn't be everyone, and we need to understand that a bit better. But they would then be considered as part of the 20 minutes drive time, and they would be included in the analysis that we've done. And the other area I think that we need to understand a bit better is the other services that can be provided by the pharmacies. So there's the option for home deliveries, there's online pharmacies, and as potential options for people who may be living in areas where it's more difficult for them to get to. So we're not saying that everyone will be able to access these alternative services, but that's something that that we are investigating more, in addition to within BCP walk times as well, to add a bit more on top of the drive times that we use here. So anything?
When we looked at the analysis, we did do them back, so we kind of looked at each individual health and wellbeing board. So the tool that we developed allowed us to run a model which would be specific to BCP, and so we looked at the different, say, catchment areas. We were able to look at drive times, cycle times, walk times, and public transport, and look at that specifically to BCP, and obviously looked at things such as car ownership, population density, the demographics of the population specific to BCP. So we kind of looked at each area on its own merits. So yeah, so that's, so we did an analysis of looking at, in terms of the home delivery, if there was any areas which you could argue that wouldn't be suitable. We did have a look at areas to see how many pharmacies within BCP did offer home delivery, which localities they were located in, and found that there is actually, for the pharmacies that do offer home delivery, there is each of the different localities we looked at, there were pharmacies in those areas that did offer home delivery services.
Okay. Any comments or questions, Karen? Did you want to?
In terms of getting around BCP in a car, it's always a bit of a challenge. Even getting on a bus from my home in Oakdale across town is but I do have a really good pharmacy right on my doorstep, so I'm okay. But there are some fantastic community transport services that can help, especially older people, get to places. And I think, maybe it's about us joining up the dots a little bit between some of the pharmacies who might not know that there's, in this neck of the wood, there's ZCAT, South East Dorset Community Transport, who could help to get them to the places where they need to be. And also older people also do struggle with a lot of online stuff. And I'm thinking of my 85-year-old mother-in-law who doesn't do online and can't hear too well and isn't near a pharmacy. So I'm just trying to think about how she would, what she'd call my brother. Thought he'd sort her out, but you know, I think there's also about a bit about how we connect in with getting people to a pharmacy, because my pharmacy is great in Oakdale, I have to say. I couldn't do without them.
No, and thank you. And I think that almost represents the next step, trying to understand what potential is out there. And I think a couple of the comments we got back on the consultation were reflective of the alternatives for elderly relatives and how what other services they could do. I think the other comment along with the drive time is opening hours. So you need often you need someone within work 9 to 5 for working hours. But if it's people who aren't relatives and so on, there's other things out there that'd be useful to have as a mapping.
There's not a lot of people older people here don't have their relatives near them. A lot of older people move to this part of the world to retire without their relatives being near. And I have to tell you, if you asked me to walk 20 minutes to a pharmacy, I would have to say I can't. You know, I really can't. I can't walk more than 5 minutes these days. So, and I don't consider myself to be old. Nearly in that.
Sandra, do you consider yourself to be old?
Just be careful. I was going to say that yes, I did enjoy reading this report, and it's got some really interesting data in it, which is good. The only I'm not criticising it. I just can't help but see bits that weren't quite right. Page 145. It's got 2 pages actually, 23 or 145, and it talks about Bournemouth hosts a university. We've got 3. I mean, the point you're trying to make is we've got a significant student population, which is right, but we have got 3 universities and a large language school. I think we got more than a large language school. We've got several large language schools. So it just sort of like emphasises the point. So I don't want to nitpick. I just can't help but break these things. Yeah, I was also going to say that one of the biggest problems I found was shortage of medicines, and I know that's not part of this, but people did comment on it, and it's even come out in when you've got repeat prescriptions. So you know they've given nearly 7 days notice, 5 days notice, isn't it, of getting the stuff in, and still it's been difficult. And that has been quite significant in the area in Poole where I live. That has definitely caused problems, and we've also had cases of pharmacies closing down in my area as well, which caused a few weeks problems because the one that closed then transferred to another, and all the patients or customers, whatever you want to call them, transferred to another pharmacy. And that pharmacy couldn't cope because they couldn't cope with all the additional people. But it worked out in the end. It just for a few weeks it was pretty chaotic. And also we've got no pharmacies that were open on a Sunday, but we've also got a large supermarket on the boundaries. So you know, you can go there because they're open from 10 to 4. But no local pharmacy in the area. And years ago, they used to have one staying open much later than everybody else's and being open on a Sunday morning and the rest of it. And everyone knew where they could go for emergency supplies. Now you're relying on supermarkets, I think. I mean, it's okay because the supermarket's quite close to me, but there will be other people that won't know that particular supermarket has got a brilliant pharmacy, to be honest. Just saying.
Okay, Siobhan.
It's really good to recognise the contribution community pharmacy makes to everything, actually. And if you look back, maybe even, I don't know, 5 years pre-COVID, I'm not sure they were as actively contributing to everything as they are now. So I just think we should recognise that. I think this is a point in time, isn't it? That's what you described it as. And it's sort of a mapping, which I think is really helpful. And also it says that we're okay from a community pharmacy perspective. The commissioning of community pharmacists, does that still come under the NHS Dorset? Yes, I used to be a director of primary care, so I did in one lifetime commission community pharmacists, because I think that's the other part of this actually that I'm just struggling to put the whole together. And I think as we move forward with the 10-year plan, the development of neighbourhoods, the role of community pharmacists, and how Pam, with you on the call, how they're commissioned to be part of that thriving neighbourhood is going to be really important, alongside the digital infrastructure that supports them. So I think it's quite good timing because you've got them all mapped, but it's sort of one half of the story. So thank you. And now I understand. But I also would say that compared to London, I think community pharmacy down here is a lot better.
Thank you for that. And also that I think some of the reviews, we've reflected the importance of community pharmacy in the future, wasn't it? So it's got a bit more of a prominent position in the report now, because especially over the lifetime of the report, that's certainly going to take a greater importance on that.
Any other questions or points that members wanted to raise before I wrap up? My only comment was it was really useful. Obviously, it's been a thorough consultation, and I know you don't get masses of people sort of responding to the consultation, but it's the quality of the response that you get, isn't it? That there's obviously a lot of sort of thoughtful responses.
Sensible ones too.
Yeah. What I like about this is also a bit future looking, isn't it? About sort of our local plan and future development, and making sure that we've got the right provision. Because whenever there's big house building, people always say, well, what about the infrastructure? What about the health services, etc., etc. And I know, living in the ward in North Pool, where probably best part of 2,000 houses are being built over a number of years, that actually we're reasonably well served actually with a couple of pharmacies. And I was actually involved 10 years or so ago, meeting with some pharmacists who really wanted to set up a pharmacy in my ward, in my local neighbourhood, and there wasn't one. People had to go to the doctors and then trek outside. And I remember dealing with pharmacists and their planning applications and having meetings and discussions with them as a ward councillor. So I sort of understand how the sort of system works and how important it is as well, because I've certainly met residents who've moved into my sort of neighbourhood and said, well, they've moved there because there's the GP surgery there, and there's the pharmacy there, and there's the convenience store and the fish and chip shop, and it's part of what actually people want to be in their neighbourhood. Fish and chip shop mainly, but the pharmacy was always something they really wanted to be there.
Wellbeing.
And I read through the report, and it's interesting because there's always a section, isn't there, about sort of climate impact as well. And I thought, well, sustainability impact. And I thought, well, how's that relevant? But it does interestingly talk about reducing unnecessary travel through accessible service provision. And you talked a bit about deliveries and the sort of technology. And certainly I had a friend who lived in Wimborne, went to the doctors in Wimborne, but then still went to the pharmacy in Wimborne to pick up the regular prescriptions. They live in North Pool in my area, and I said, well, fair enough if you need to stay with that GP surgery, but you don't need to keep going there to get your prescriptions, don't I? And they just set it up so that actually, as soon as the repeat prescriptions are in, picks it up from 3 minutes around the corner at the local pharmacy in North Pool. And that's reduced a monthly trek to Wimborne every day. So I think part of it is about information sharing, actually people being aware that just because that's the way they've always done it and that's always the place they've gone, it doesn't have to be like that. They can get deliveries done, they can get messages sent to their local pharmacy when they've moved away, and that sort of thing. So it's making sure that I think people are informed and understand how the system works, and that really can sort of not just improve accessibility, but actually just make people's lives easier. So yeah, thanks for all the work. Thanks Rob. Thanks Rohan, Lee, and Paul, and he's at the back there as well, for all the work you've done on this sort of comprehensive report. And hopefully we can do it justice. So the recommendation is that we note the outcome of the consultation, and that the board approves the new pharmaceutical needs assessment for publication by October 2025. So are we all happy to do that? I know Rob's relying on us to do that. Is everybody nodding? All in agreement? Nobody in disagreement? Great. So that's that's approved. So thank you for all your work. Thank you for coming along. Hope it wasn't too difficult. Thanks. Right. We'll move on to agenda item 10. I think we're still quite well on time, aren't we? So, yes, the BCP Health and Wellbeing Strategy. Thanks, Rob. I know you've been doing some work on this with others, with Kat and Mark. So, yeah, I don't know who wanted. Rob, did you want to introduce this item?
Yeah, thank you, Chair. So just in terms of an update in relation to our draft health and wellbeing strategy, and I'm going to present a short presentation with my colleague Kat Macmillan, who's joining us online, and Mark from the Integrated Care Board. Again, board members will be aware that we do have a statutory requirement under the Health and Social Care Act to produce a health and wellbeing strategy and to address local health and social care needs, improve health outcomes and reduce inequalities. And board members will be aware that we've been on a journey of co-producing a health and wellbeing strategy, and probably over the last 2 years. On our previous strategy ran from 2020 to 2023, so we do need to produce an updated strategy. The board has previously agreed to take a 3-layered approach to the development of the strategy, and that was to adopt the Integrated Care Partnership Strategy, working better together as the framework for our health and wellbeing strategy, to ensure that the health and wellbeing strategy contributes to the delivery of the Council's corporate strategy, and also to ensure that the health and wellbeing strategy contributes to the delivery of the NHS Joint Forward Plan. And we would probably update that now to talk about the 10-year plan going forward. Oops, seems to be moving on. And the strategic context and some of the complementary work taking place. So members will see within the draft strategy that we've produced, we've listed some of the complementary strategies that are already in place across BCP that complement the work of the Health and Wellbeing Board and the Health and Wellbeing Strategy. And we don't intend to replicate that, but we just want to make sure we've got that connection with those other partnerships and strategies. So I won't sort of list all of those here, but colleagues will be aware of our Children and Young People's Partnership Plan and the Children and Young People's Partnership that is in place to drive that important plan. Also the Adult Social Care Strategy that we have in place, and we've recently developed a Adult Social Care Prevention Strategy as well. And we've got a number of transformation programs that are already in place that are actively contributing to health and well-being of the population. And then clear links also with our community safety partnership work and also our housing and homelessness reduction work. And then just at the bottom there, really being cognizant of the new 10-year health plan. That isn't just an NHS plan, it is a plan for health. And the requirements on the Health and Wellbeing Board for us in the future to also develop a neighbourhood health plan. We're currently waiting for some additional guidance in relation to what that neighbourhood health plan needs to look like, but it is very much seen as being one part of the local health and wellbeing strategy, delivering that neighbourhood health aspect within the 10-year health plan. And I think the expectation is that we will potentially have to produce that as a health and wellbeing board by the end of December, but there may be some slippage on that where it may be required by the end of March next year instead. But we await further guidance on that one. Okay, I'll hand over to Kat now, who's going to tell us a bit more of the priorities that we've previously discussed here at the Health and Wellbeing Board.
Thanks, Rob. So, longest-standing board members will remember at the tail end of 2024, Sam held a consultation with board members to identify what the new strategic priorities should be for the Health and Wellbeing Board going forward from 2025 onwards. And we were given a list of about 10 or 11 different priorities that were evidence-based coming out of the Joint Strategic Needs Assessment to try and identify where we would add the most value and make the most impact as a board. And the responses highlighted children and young people, community mental health transformation, supporting adults to live well and independently, housing, and cost of living and poverty as the priority areas for the board. And they've been sort of fine-tuned to these 4 priorities that you can see on the right-hand side of the slide. So children and young people is starting well. Community mental health transformation is mental well-being. Supporting adults to live well and independently is living and ageing well. And housing and cost of living and poverty is healthy places and communities. Next slide, please, Rob. And just a reminder again about the role of the Health and Wellbeing Boards. So again, our last meeting was the one before actually, in January 2025, we focused on what is the role of the Health and Wellbeing Boards. So it's looking at identifying those strategic priorities where we can champion, monitor, drive forward, and most importantly, add value to the work that's already taking place. Looking at how we can bring partners together to share work programmes and shared priorities that respond and contribute to local health and wellbeing. Support the inclusion of health and wellbeing in the development of all policies. Look at relevant data and metrics to monitor progress and make sure we're making a difference. Focus on working together and co-production and the voice of lived experience. And sponsor the work of a place-based partnership and champion integration of services in local neighbourhoods. And probably one of the most important ones for me with a communities background is adopt the Poverty Truth Commission Access to Service Principles. And they focus on consistent and connected services from cradle to grave, a whole person and a whole community approach, services when and where people need them that everyone can access, dependable and supportive relationships, and everyone is treated with dignity and humanity. Next slide, please, Rob. And so in relation to the actions under the 4 strategic priorities, you'll have seen in the draft strategy, we've identified and proposed, they're just proposals, a number of actions linked to each of those priorities. Those have been identified through conversations and consultation with board members and other key stakeholders, but obviously there's further work to be done. So this is sort of being presented to you to get a nod really to go forward and do that further work and engagement. So some of those proposed actions will be for the board to champion and monitor, while others will be for the board to actually drive action forward. A draft performance framework's been identified so that we can monitor that progress, and that includes a key selection of indicators from some of those existing indicators which already took place. Again, saying we don't want to duplicate or create extra work. This is about meaningful activity. So those have been drawn from the corporate strategy, the public health outcomes framework, and the proposed local government outcomes framework. And progress against these indicators will be reported back to the Health and Wellbeing Board on an annual basis. And I'm handing now over to Mark for the last couple of slides. Thank you.
Thanks, Kat. So really the last 2 slides really are just around, well, what now? How do we make this happen, and what next? What steps do we take? So I guess really in terms of making it happen, our focus really is around actually how do we get the board into that space around assuring delivery of the strategic priorities that Kat's just been through. Also connecting that though into other partnerships. So the bit around not duplicating, adding value is really, really critical. So just being cognizant that there's lots of work going on in other partnerships and boards. What are the bits that we need to pick up as a health and wellbeing board, which then we need to drive forward? Kat touched on the place-based partnership, which we've talked about here previously as well. So again, thinking about sort of those drive actions that we take ownership for through a place-based partnership and sort of oversee and coordinate the delivery of those. I guess the spirit by which we need to do this is really around how we collectively hold each other to account for delivery, but also sort of to commit then to a forward plan that enables us to give that assurance. So as a board, assuring again that this delivery of that strategic priorities and the overall strategy. in order to sort of support that, then there's the annual review or an annual joint strategic needs assessment that will be produced. And again, the sense checking of that really on an annual basis to make sure that the priorities that we have got are the right priorities, and whether or not that we need to be agile. I think someone mentioned before about being agile, especially with all the change that's around 10-year plan and stuff that comes up through neighbourhood health plans. Actually, how do we sort of pivot and respond to those needs as and when they become identified? Next slide, thanks. And then so finally, just in terms of the next steps, so what's been shared within your papers is obviously a draft strategy as it stands at the moment. What we are seeking is some comments and feedback with a view to developing a final version of that strategy. We're also sort of convening a workshop in November to take stock of the 2025 review of the Joint Strategic Needs Assessment, to look at whether there's any further refinement that needs to happen to the current version that you have in your papers. And also, as Kat mentioned, undertake that further engagement with a broad range of stakeholders, including the community and the voluntary sector. So the proposal then really is to bring it back to this board, to the board in January for final approval and publication from there. And that's it. Thank you.
Great. Thank you, Rob, Kat and Mark. Yeah, comments or questions from any? Siobhan, yeah.
Again, it's quite timely, isn't it? I suppose what I'm pleased with, in the paper, it didn't mention the timeline. So I was thinking, what's the timeline? So thank you at the end, got the timeline. I suppose it's just really important that there is that workshop and there is co-production because of the cataclysmic changes that have happened across NHS particularly, and I know everywhere actually is going through a lot of change. And so I do think just sense checking where you've got to is going to be really, really important because this document as a strategy for the Health and Wellbeing Board will be really critical in terms of what's happening with future neighbourhood plans, how we're working together outside of hospitals, in hospitals, you know, it's going to be really important. So I just think when you look at this, at the beginning it sounded slightly out of date, but I think that's because the pace at which everybody's changing. So I do think the workshop is really important, but thank you.
Thank you. Betty?
Yeah, I think it's really good actually. The draft, and I don't have huge amounts of comments because I've already commented because Rob made sure that everybody had the opportunity to do that before. Just picking up on Siobhan's point, I think it is really important to co-produce, and I know that's at the centre of this and at the centre of what we want to do. And I was pleased to see all of the other current strategies that complement this strategy that we'd listed. And I was kind of looking at that, thinking, well, we can't have an endless list with every single one, but I thought they were probably the key ones that we wanted because it cuts across all of the areas. I do think the strategic direction of travel is changing so rapidly that we have to be able to flex this as well. And I think that's what Siobhan was getting at. You know, it's very timely, but we do need to have some flexibility within it. And I just wanted to support Kat's point that she laboured about the Poverty Truth Commission and the principles, and I absolutely fundamentally support those as well, Kat. So I just wanted to kind of pick up that because I know how important and how key they are within this. I just wanted to acknowledge your kind of focals around that as well. Thank you.
Any other comments or questions? I know some members had sort of already sort of seen it and fed back to Rob and commented on the draft. Any other comments on nothing online? I take that as an endorsement of where we are in terms of the draft strategy. Yeah, I'm really pleased. It's sort of with this draft, it's it's able to now take some cognizance of those bigger changes that are going on around us. And you mentioned the sort of 10-year health plan, I think particularly. And yeah, I think Kat and Betty, you mentioned about the Poverty Truth Commission. I think that brings to me very much about the workshop we had some months ago about health inequalities. There was we had a sort of cross partnership workshop, was it earlier in the year, very much about how we sort of deal with inequalities in health, and a lot of that was around access. So I think that's a really important thing to keep in mind. So yeah, I'm pleased with where we are, and that we've got the workshop scheduled in a few weeks' time, haven't we? To I think Siobhan is right, to sort of sense check it, to say we're sort of okay with this, but does it make sense in the new context of where we see nationally and regionally things are going? So so yeah, if everybody's okay with that, then we're asked to note the progress made to date with the development of the draft strategy and approve further engagement with stakeholders, as has been mentioned, and approve that the strategy comes back to the Health and Wellbeing Board in January for approval following that engagement and the workshop we've got coming up. Is everybody happy with that? I've got people nodding online and nodding in the room, so good. Good. I'm glad we've not had anything in this meeting where people have had to raise their hands and I've had to count how many for and how many against. It's all done by consensus. So yeah. I wish some council meetings would be like that. But, great. Okay. Thanks very much. Oh, Karen, did you want to come?
Just really quickly, the workshop, my friend here tells me, is on the 3rd of November.
Yes. I think that's...
How wide do you want that to go in terms of people inputting into it, in terms of people living, local people? How big is it and how wide would you like? I haven't got it in my calendar.
Rob, did you want to?
Yeah, thanks, Karen. So the workshop is for the board members. So it's this group, really, quite a small group. I think there's been a process previously of doing an annual JSNA workshop where our public health colleagues who've updated the JSNA will come along and present the latest data. And then we'll build on that by then looking at the draft strategy and checking whether we've got the priorities right, starting to think what some of those drive actions will be then. I think after that, when we've got a kind of a second version of the draft, we can then look to do some wider consultation. Particularly,
Going to offer to help. That was what my,
great.
yeah.
I was going to ask you to help, so that feels good. So yeah, happy to work with you when we've got a bit more. When as a board we've looked at the priorities together and we're happy we're on the right track, which I think today's been really positive in getting us there. We'll then look to work with you to see how we can get more input into it. We're not required to do public consultation on the strategy in the same way we are on the pharmaceutical needs assessment that we looked at today. But obviously it is good practice to engage broader stakeholders and particularly the VSE sector. So we will look to do that.
Someone, Louise, if you don't mind, I don't know why I haven't got it in my calendar. So I'll look into that. It might be me. Who's arranged the workshop?
Holly sent me data. I can ask Holly to make sure that all board, working with you, Louise, to make sure all board members are invited to that. Great.
Okay. Good. So everybody's happy with that, and we've okay, approved that sort of draft strategy, and it'll come back to the Health and Wellbeing Board in January for approval. Great, thank you, Rob and Kat and Mark for getting together and putting the time in to work on that. Right, next is agenda item 11, our work plan. Just call it up on my screen. Yeah, we had quite a few items on today's agenda. So yeah, for the January meeting, the Health and Wellbeing Strategy into Action Place-Based Partnership work, as we've just mentioned. Annual report of the Community Safety Partnership, the Better Care Fund Q2 report. So Scott will be coming back again. That's what we've got at the moment. I mean, I suspect that there may well be other things or other updates that come in before then. Any comments on our work plan? No. So our next couple of future meetings are 12th of January and the 9th of March. If everybody's happy with that, then I will close the meeting. Thank you for your time. Thank you for those of you particularly that attend in person, because I'm always keen to make sure we cooperate and we've got the right people in the room, and all those that are online as well. Sorry, Karen, did you want to?
May I have a quick AOB?
Go on then.
Chair? It's a good one.
Go on.
At the last Health and Wellbeing Board, I shared a lived experience with Steps to Wellbeing and how I was left at the side of the road, basically. And as a result of that, I put my professional hat on and I spoke to NHS Dorset, who commissioned Steps to Wellbeing, and said, could we maybe when Steps to Wellbeing send you the email to say, I'm really sorry, it's a 7-month waiting list. These are things you could try. If you can afford, you can pay and you can do this. I said, because you've commissioned this fantastic thing called Access Wellbeing, with all these fantastic hubs and support, and it doesn't say that on your email that you send out. And he was like, I will make that change straight away, Karen Loftus. So I'm really pleased because, you know, if one person can get that email and go, oh, I can go into the hub in Poole, in the Dolphin, or in Boscombe, or I can, because we've supported 53 groups across the whole of Dorset with £1 million of grant funding to kind of improve and enhance their support to mental health and well-being. So, you know, they're there to be used. So, you know, okay, if you can't get into Steps to Wellbeing straight away, but there could be some other things like the prom walking people or an allotment, or there could be some other stuff. So I was really pleased that, you know, sharing that has resulted in a positive outcome. So I just wanted to share that.
Thank you for that. I'm glad I let you add your any other business in. That's a nice way to end the meeting. Yeah, nice way to end the meeting. Right, thanks very much. We will close the meeting.